Dr. Chatterley, let's talk something again which lately has made it into the news a lot, and that is people falling asleep in the afternoon on the wheel, wrapping a pass around the ball like just happened in New Jersey, and otherwise simply dozing off. No control over their bodily function for that much in terms of like not sleeping. And more and more over the last year or two, it has been found that sleep apnea, meaning stopping to breathe and waking up during the night because of not getting air, is the cause. Most people who snore have that, and they wonder why they wake up tired, exhausted in the morning already. It's because they sleep apparently 6, 8, 9 hours the way they should. They should really sleep 8, 9 hours, as we know. But whatever it is, they do get in sleeping, but they don't, and they don't even know it. And thus they simply pass out in the afternoon. Can you shed some light on that story, and what are the solutions which one can do there, rather than taking a coffee and a Red Bull in the afternoon?
Yes, and matter of fact, we've had several patients that have come to us and have had that experience, and myself at one point in time, I can relate to it. If you may think you're getting a good night's sleep, or because you're spending the time, but in reality, if you have even not a very severe sleep apnea, you're robbed of the effective sleep because of the lack of oxygen. And most people that snore have this effect because in the process of snoring, they alter their breathing, and they well, like my wife used to complain, she wasn't didn't fall asleep before I did, and then she would hear me go long lapses and then snore rather loudly, and you don't really catch up enough breath when you've gone almost over a minute holding your breath, and your oxygen level goes way down, and then when you grab that breath, you're not making up the difference. So sleep apnea definitely has, as they've studied it more and become more aware, they realize there's a lot of people in the public that are suffering from this, and so you see the alternative solutions, caffeinated drinks, advertising, get a boost in the afternoon, have a Red Bull, have this. That's not really a solution. It's that has side effects also. So people are much better off if they can help resolve the sleep apnea situation, rather than trying to get a chemical substance boost in the afternoon. And there's several different appliances that dentists can make that repositions a person's jaw that helps resolve the snoring, because the snoring happens in the back of the throat, and so if they get the jaw repositioned down and forwards, and it's at a point where it's comfortable enough, and then opens the airway in the back, that's the first line resolution to the problem.
So that the snoring goes away and the stopping the breathing goes away, and the person sleeps again a full night's sleep, which is why he wakes up in the morning rested and doesn't, so to say, literally pass out towards the afternoon.
Right, effectively and efficiently sleeps by getting oxygen into a system throughout the night instead of periodically kind of a up and down pattern, and missing out on the restfulness of the sleep, because they're almost waking up as they struggle for breath after the body, even in the rest position, gets to a point where it's gasping for air, so to speak. So they're not into the REM sleep, the deep sleep, as they need to be to get the rest and the recuperation that rest brings.
And they don't even know it, right? I mean, it's like you think you sleep all day, but you really don't, because like most people who snore, don't know they snore. I mean, they might know it here and there a little bit, they may have an inkling of it, but they really don't know the extent of it. And they also don't know the fact that they gasp for air. Because as I have learned this from dentists like you, I've told my wife, I went home and said, you have sleep apnea. And she did get a test. Then, she found out to wake up several times an hour, as much as 1 minute. And the doctor told her, the sleep test person told her, wasn't the doctor, that she gets a whopping 2.5, maybe 3 hours of sleep, and yet we both, my wife and me, are very long sleepers. So she now actually just got such an appliance. Well, she's getting it in a few days, but she tried a sleep machine, a CPAP machine, an oxygen machine, and my wife is one of the most dedicated people you can find when she needs to do something. She just doesn't stop it. She's just, big-headed determination. And let me tell you, that sleep machine, yes, she apparently breathes now, but she now wakes up because of that machine, because basically you have a huge mask on it with a hose on it, and you can't toss and turn the way you want, and that in itself, must wake you up if after 50 years of sleeping a certain way, 55 you all of a sudden need to sleep different. So she's looking forward to the sleep appliance, and a dentist who made it for her, or is making it for her, he wears it himself, and he says, he woke up tired, he fell asleep in the afternoon, he was exhausted, and didn't know why. And he says all of a sudden, in fact, he lost weight, and all kinds of things. In fact, let me ask you another question. I've read that people with this sleep apnea seem to be needing to go to the bathroom to go pee-pee more often. Any truth to that?
I'm not
not really aware of it. Just something I read somewhere. Again, that's probably a hassle in itself, but they're waking up.
Well,
all right.
If they're not sleeping deeply enough, they're going to be aware of, what their body's needing, and if they went into a deeper sleep, they wouldn't have to go as often, just because the body would be slow and relaxed, and just wouldn't be called to their attention as often. Makes sense.
But okay, makes sense. So the point is they're not sleeping well. So what is your take on the, when a person gets told that he should be having this CPAP machine, the machine which pumps air in it, because it is considered to be a very well functional thing if people wear it.
Yeah, that's the thing. If you need glasses, which I do to read, doesn't do me any good unless I put them on. And same thing with the CPAP machine. If that's the solution, and you have this mask over your face, what I've been told by a number of patients is it gives them a very claustrophobic feeling, and so the learning curve for many of the patients that I've talked to that have been advised to have a CPAP machine is that it took them a long time to get used to it. For the other reason that you mentioned, they had to alter their normal sleeping habits because they were used to sleeping on a side. They couldn't do that as often, as comfortably. So I always suggest to them, hey, why don't you try the gentle repositioning mouth appliance and see if that's sufficient to help you out in the matter. Now, there's some people out there that have such a severe case of combination that they really will only get help with the CPAP machine. But if they can get more for less and less involvement, and it's not as big an obstruction, try that first.
Absolutely, and I think that's probably where the majority of people will fall into it. Again, appreciate you telling us about it. There seems to be a tremendous amount of more people out there having this problem than anybody is suspecting, and that's kind of coming to this surface now. So, a good night's sleep is many people, besides of sleep apnea, but, doctors have complained that this generation, our generation, the younger generation, anyway, that we sleep so much less than we used to, and there's a correlation between literally going insane, being depressed, and all that stuff. I know when I don't sleep for a couple days, my 9 hours and 8 hours, I get all kinds of things. You get irritated. You just don't want to think. You have a problem. You don't want to solve it because you're too tired. It's difficult to get you excited about something and obviously do a worse job at work. And then there is, of course, the other things, the attention, the driving. Things like that may not be as visible when you're like 20. You can go out and, be in the bars, hopping, and only sleep a few hours, but it looks like, people need to sleep, and that's just very important, especially if it's camouflaged. If they think they get it and they don't get it, they should do something about it. Anyway, bye-bye, Dr. Chatterley.